My name is Al Amalados and I'm the Deputy Medical Director for Medical Education for Sussex Partnership NHS Foundation Trust. And on behalf of the Trust, I would like to welcome you to your new posts. We are a large mental health organisation. We provide services in West Sussex, East Sussex and Brighton and Hove out of over 140 sites. We have about 100 junior doctors working with us, together with a similar number of consultants and associate specialists.
Recently we expanded a lot the foundation posts in psychiatry because there is a national drive to have as much exposure to community posts and mental health posts for foundation doctors, because you can develop generic skills that are useful for any career, but also for foundation doctors to have experience of mental health. 1 in 5 of the population will develop mental health problems, so it will be almost impossible to do any career in medicine without coming across someone with a mental health problem.
So I'm James Fallon, I'm the locality tutor for North West Sussex. I'm a consultant psychiatrist in the early intervention in psychosis team. So in North West Sussex we cover quite a big geographical area. In terms of the inpatient units, our main unit is Langley Green Hospital based in Crawley. We also have a child and adolescent unit in Haywards Heath, which is on the Princess Royal site, and during the on-call sometimes you'll be called to the Princess Royal Hospital itself. There's 1 or 2 other areas that you might be called to when you're working the on-call shift, and those are Iris Ward based in Horsham and 78 Crawley Road. During the course of your rotation with us, you'll be placed in 1 primary location. Now that might be the inpatient unit, either at Chalk Hill for the child and adolescent team or at the Langley Green Hospital in Crawley. Some of you will be in community placements, and those could be in areas such as Ifield Drive in Crawley, New Park House in Horsham, and there's 1 or 2 placements in slightly further afield in places like East Grinstead.
I work primarily at Linwood, and I work within the Living Well with Dementia team. My 9 to 5 job really is seeing patients in clinics, also doing home visits, going out to see people in nursing homes or residential homes, working with the dementia crisis team from time to time, working with the CPNs, working with the support workers. So it's quite varied, my day-to-day job.
Hi, I'm Harriet. I'm a core trainee in Sussex. I'm working in Horsham at the moment in New Park House, which is a community outpatient unit. I'm working with the general adult team there. It's usually about half a day of clinics and then half a day of kind of admin, tying all the stuff up from the clinic in the morning. If the nurses have any questions about prescriptions or giving people repeat prescriptions, kind of dealing with that as well. And I'm also doing the on-calls at Crawley, Langley Green and at PRH in Haywards Heath. And as a core trainee we also do psychotherapy, so there's quite a lot of different aspects to my job, and psychotherapy is 1 morning a week on Tuesdays.
You're the person who's on site, but quite often there's either a registrar or a staff grade on the rota, so you can call them for advice, or there's the on-call consultant that you can call for advice as well. And then there's also something called SMPs, which are specialist nurse practitioners who cover both sites, and they're very experienced. They're a great source of help and support.
I'm Sharon, I'm the lead nurse on OPA ward here at Langley Green. Langley Green is a fantastic place, there's lots of exciting things happening. I do a number of things, but one of the things I do is phlebotomy. We've got lots of people that have done the training and they're all going to be able to help you all do phlebotomy on the ward and help you enjoy your time with us.
The hospital has got 4 wards. We have got a PQ, it's one of the 2 PQs in the whole trust, which is 12 bedded. And then we have got 3 wards, which are 19 bedded each. They're well staffed with a full-time consultant, staff grade, and nurses, OTs, the full works.
When you're starting a psychiatric rotation for the first time, it can be quite daunting because it's very different to kind of hospital specialties or general practice. But I think it's just important to take your time and always to ask people who are more experienced. So the nurses on the wards are a really good source of knowledge, and the consultants. and I suppose, yeah, just not being afraid to ask.
My name's Donald MacDonald. I'm a charge nurse on Opal ward at Langley Green Hospital. I've found all the staff here to be very supportive, and anybody that would come here would get the support from the likes of myself and other members of staff. It's friendly, it's nice, and you should find the work interesting.
We have a regular educational program on a Wednesday between 2 and 4, which is very well attended, and there are presentations from other consultants. We bring speakers from outside as well, and that should be a very good learning experience.
As part of the academic programme, you have the opportunity to present cases to the group, and the group is made up of both consultants and senior staff members, as well as other trainees. And depending on your experience, you can really pitch it, more towards the trainees or more towards the more senior members of staff. And that's a really great learning opportunity, and it's a very supportive environment. There's also opportunity to take part in Journal Club, which is where you can present a paper that's interested you and discuss it amongst the group as well.
There's additionally something called a Barlink group, which we run on a weekly basis. And that's an opportunity for you to take a psychological look at some complex cases or difficult interactions that you've had, and we've found that trainees seem to get a lot out of that from looking at things in a slightly different light.
There's also the MRC Psych course, which is held down in Brighton, and you go every other Thursday in your CT1 and 2 years. And that's a really excellent course that is run in conjunction with Brighton University, and it's great preparation for the exams, as well as if you wanted to do some postgraduate studies.
It's a great opportunity to work with Brighton and Sussex Medical School and start participating in audits which are relevant for patients' care, in research projects, and I'll be more than happy to support everyone to undertake such a project.
Hello, my name's Wahiba. I'm a GP trainee and I'm based at CAMS at Princess Royal Hospital. I sit in on clinics, do some school visits, home visits. So there's lots of opportunities to do case-based discussions and things, especially when you're in clinic. You can see patients on your own and then discuss them with a consultant or somebody more senior, and then you can get feedback on that. Also, on-calls are quite good time to get some learning. There's always people around to discuss things with and ask for help if you need.
My name's Edward Lepper. I work for the Mental Health Act Department in Sussex Partnership. My role is the Practice Development Officer for Mental Health Law, which means I'm a trainer for people on the Mental Health Act and the Mental Capacity Act. For junior doctors, we're going to do a training session around their responsibilities under the Mental Health Act.
Every junior doctor from the beginning of their job will know what their work schedule is and what their worked hours should be. If at any time they work in excess of those hours, then what they should do is to enter what's called an exception report, saying when they worked over, how much longer they worked over, and what was happening at the time, and then submit that. That will go to their educational supervisor, and a copy of it will also go to me as the guardian of safe working hours.
So at the start of the rotation, try and see your educational supervisor as early as possible so that you can set objectives with them and get a good idea of what's expected of you as well.
During the course of your placement, feedback's going to be really important, and that's feedback to you in terms of how you're doing and ways that you can improve your practice. But also it's important that you give us feedback on how things have been and whether there's areas that you think could be improved so that we can make things better for people who come afterwards. So I really strongly encourage you to feedback at the number of different places that we have, either through contacting us directly or through our trainee forum, which runs once every rotation.
Working at Langley Green and training here is a unique opportunity to develop amazing skills in assessing and supporting patients with severe mental illnesses, learn how to support their families as well in the true spirit of MDT working.
It can be quite busy, especially when you're on call, but it's very enjoyable because there is so much variety and quite a lot of scope for you to adjust your job to what your particular professional needs are.
The best thing is the experience, and there's lots of variety of patients and things that you wouldn't normally see in a hospital job.
It's a really good chance to kind of get a bit more confident, a bit more independent with seeing patients and kind of thinking about making decisions about management and following them up as well. It's quite useful in that way, whilst still feeling like you're quite well supervised. I think that's probably been the most valuable thing for me in this last 6 months. Yeah, I'm enjoying my training.
People are really friendly and really willing to support you, so if you're not sure, if you're interested in something but you don't really know how to, get involved with it, I've found that everyone's really helpful and supportive.
So it's really nice to have you all here. I'm really hoping that you enjoy your rotation, that you get the best out of it, and that we can help you learn as much as you can about mental health before you move on to other things. Or for those of you who are staying with us and going on to train in psychiatry, it's really good to have you here, and I wish you the best for the future.
Mental health is very important regardless of which medical specialty you finish up in, because you will always come across people with psychiatric illness, and you need to be able to recognize that and at least have a discussion about how their problems can be managed. I do hope that your time with Sussex Partnership will be a profitable experience for you, and that you will learn as much as you possibly can in the 4 or 6 months that you are with us.